Okay, the time is now 10 o'clock. We are going to begin. I want to welcome you to the Prevention Playbook Strategy, Action, and Community Change program. Today's session is all about moving prevention from good intentions to real measurable impact. So, too often prevention planning gets stuck in checklists and activities and disconnected efforts. But this webinar will focus on how to strengthen strategy, align action, and drive meaningful community change by using prevention science, systems thinking, and practical tools that coalitions can actually use. So together, we'll explore how to move from planning to action, how to identify leverage points within community systems, and how to make prevention efforts more focused and intentional and sustainable. Whether you're working with a coalition, leading a program, or supporting community partners, this session is designed to help you sharpen your approach and strengthen your impact. This is our acknowledgement slide, and in short, it lets you know that the opinions that you hear expressed are the view of the authors and do not reflect the official position of the Department of Health and Human Services or SAMHSA, and no official support or endorsement of DHHS or SAMHSA for the opinions described in this document is intended or should be inferred. Our objectives for today are quite simple. We're going to talk with you about how to apply an understanding of the socio-ecological model for root causes to the creation of a rich picture of community challenge. We'll diagram out the systems using the 5 R's, and I ask you to please have some paper and pen handy with you today for our exercises that we'll be doing. We'll also describe how having a rich picture of a system can support strategic planning efforts. This is our roadmap for today. We'll start out with a challenge for you. You'll have brief introductions. We'll talk with you about planning framework, a root cause analysis, do an exercise on rich pictures, and then we'll wrap up. Be sure to stay to the end so you can do the evaluation. Without your input, we don't know how we did, and it's extremely important to us to get your input. So stay around for the evaluation. It is my pleasure to introduce Sarah Davis. Sarah brings a strong background in prevention and community change. With a practical approach, it helps coalitions move from planning to action. And she has extensive experience supporting communities in using data strategy and systems thinking to strengthen prevention efforts and create sustainable impact, which we all need today. She'll be guiding us through key concepts and tools that help turn prevention plans into meaningful community change. So we're excited to have her with us today. Please join me in welcoming Sarah Davis.
Great. Thanks so much, Derek. Good to see everybody. Fun to see where everybody's joining from in the chat. Good to have you with us today. We've got a big group, but we're hoping to have a nice interactive session. So thanks so much for taking time out of your day to be with us. So we're going to start off by thinking about what our current state is like. And we know that any effective game plan starts with knowing where you're starting from and where you're trying to get to. So for our planning, we're going to use the terms current state. That's where we are right now. A challenge. We're going to think about a challenge that we're currently facing. And then we're going to think about a future state. This is our vision of where we want to get to. And in order to move from our current state to our future state, we need to change the system or the playing field in which our challenge exists. So in today's session, we'll do a preview of some activities that you could do with your coalition or other community partners. So we're going to start off by getting clear about what it is we're trying to address. So if you're comfortable, I invite you to soften your gaze or close your eyes for a moment and take a moment to think about a challenge that's facing the community that you're working in, something that you're working to try and address. So get a good picture of what that challenge is. What's the issue? Who's impacted by that issue? Are some people experiencing the challenge more than others? What's the result of the challenge? What's the impact on individuals, on families? What's the impact on schools or businesses or the healthcare or mental health system? What's the impact on the community? These might be social impacts, health impacts, maybe financial impacts. So go ahead and open your eyes. Now that you have this clear picture in your mind of a challenge that you want to address, we're going to get specific. We're going to practice turning that challenge that we were envisioning into a concise statement. And we'll use this formula that you see on the screen as a guide. So to write our challenge statement, we can use this formula. This health and safety issue be specific about the community that's impacted, results in, what was that impact that you were picturing? So here's an example. We start off by mentioning the health or safety challenge. There are high rates of high uncontrolled type 2 diabetes among individuals in the Northside community. This results in missed days of work and preventable visits to the emergency room, causing economic hardship and lower overall well-being for individuals with uncontrolled type 2 diabetes. So we started off by highlighting what the health issue is, the high rates of uncontrolled diabetes. Next, we mentioned in our sentence who's impacted. We see substantial impacts in the Northside community. And then finally, the end of our sentence is we finish by talking about the impact that it has. The missed days of work, preventable visits to the ER, economic hardship, lower overall well-being. So in 1 to 2 sentences, we've talked about the health or safety issue, the community that's impacted, and what that impact is on that community. So now it's your turn to try this. So think back to that picture that you had in your mind of that challenge that's impacting your community. Here's the formula to write our challenge statement up on the screen. So using a piece of paper or open a doc on your computer and practice writing a 1 to 2 sentence challenge statement that describes the challenge that you're focused on in your community. So we'll take about 3 minutes to do this on our own. So you'll start off by naming the health issue. You'll mention who the community is that's impacted, and then you'll state what the result is. And in our challenge statement, we don't have to solve the problem yet. We're just getting clear about what that challenge is. Great. Jules, I notice yours about youth vaping nicotine in a community, in a specific community, results in higher disciplinary measures in the schools and lower attendance. Great example of really naming what the impact of the health challenge is. Jillian adds a great example, affordable housing issue in lower income families in Clinton County, and that results in an increased homeless rate, children not attending school, and hygiene issues. Great job, Jillian, of mentioning the different levels and layers of impact that a particular challenge can have. I'll let folks scan through the chat as you finish writing your own. Jana adds alcohol and drug use in Carlsbad community results in higher crime, mental illness, and a rise in DWIs. Nice, clear statement. Great. Raymond notes the connection between teen mental health in our community, resulting in, assuming poor mental health, resulting in underage substance use and suicides. Great. These are some great examples. You can keep scanning through these, keep working on your own. Excellent examples of nice, clear, concise challenge statements. So now we're going to give you a chance to meet some of the other folks who are on here with us and interact with each other. We're going to be in groups of about 4. We'll ask that you turn your camera on. It really helps us be able to connect with each other. If you're not able to have your camera on, just let your group know that so they know you're there in the breakout room with them. We'll ask that you introduce yourself, name, organization, role, share your challenge statement. And then what we'd like you to share is talk about what it was like to write a challenge statement. Was it easy? Was it hard? Anything that surprised you when you wrote your challenge statement? What would it be like to lead your coalition through this type of exercise? So Richard has dropped those questions in the chat as well, and we'll head off into breakout rooms, and we'll be back in about a few minutes here. Blanca, what was the challenge that you came up with?
I came up with the underage access to alcohol in Potawatomi County, and it causing brain development or lack of brain development, and then issues in school, like if like their grades, and then it could do like health issues.
Yeah, great. I appreciate how you named some of the impacts, starting with the individual impact about brain development issue, but then how that spills into experiences in school and whether you're able to stay in school, and then longer term health impacts as well. What was it like to write that challenge statement? Did you find it easy or hard?
It was easy because I actually do a training for law enforcement for access to underage drinking, for how to prevention with underage drinking.
Yeah. So you had that challenge well formed in your mind already.
Yes, and then it also helps that we do the training, and then law enforcement officers go out in their counties and go do the compliance checks and all that to make sure liquor stores or bars are not doing over service, but also making sure that they're verifying age. And so getting the statistics on that and showing which county is the one that's lacking.
Okay. Yeah, so that was easy for you to then identify what community might have a specific, might be experiencing the challenge at a higher rate of burden than others.
Yeah, it's more known with the travel counties. So
okay, yeah. Oh. I'm curious what that experience was like writing a challenge statement. Drop an adjective in the chat to describe how you found that exercise. What was that like? Writing a challenge statement. Did you find it easy? Was it comfortable? Was it a new experience? Was challenging? Some of you found it easy. Virginia Lee found it clarifying. Gave an opportunity to pause and reflect. Sometimes it felt like it came naturally. Well, it was thought-provoking. It was helpful. So for those of you who found it challenging, is there somebody who'd be willing to come off of mute or put it in the chat? What was challenging about writing a challenge statement? What was hard about that? Kimberly mentions that it was challenging to narrow the 10 counties down to one problem. But once you were able to focus on one, then it felt a little bit more straightforward. A few other folks agreeing with you there, Kimberly. Yeah, choosing one to focus on. Thanks for uplifting that particular part that's hard about writing a challenge statement. One of the benefits of doing this kind of activity is that it does help us get focused. So we are aware, based on data, of all kinds of challenges that our communities are facing. And being able to write specific challenge statements helps us get really clear about a particular challenge in a particular area that perhaps our coalition is working to address. So putting together the components Santiago mentioned. So even though you might have the idea in your head, it's challenging to write it in 1 or 2 sentences to get it written down. So as I mentioned, we're going to be doing teasers of a few different activities in this workshop that you could then do with your coalition or partners. And this is a great one. It's a great one that can help get everyone on board. That can help get all of those ideas in everybody's heads onto paper, get everyone swimming in the same direction, invested in a common challenge. And Richard is going to be dropping a handout in the chat that I'll be referencing throughout. So this is something that you can use with your coalitions after this workshop. Provides details on this activity that we did, that formula that we used to write the challenge statement, and some information about other activities that we'll go through as well. All right, so you've had some time to think about that current state, the current challenge. The future state is if we flipped that challenge on its head. What would it look like if this problem was addressed? So now our planning can really focus on the changes that need to take place in the system in order to get there. And to know what kind of changes we need to make, we need to have a really good, deep understanding of our challenge, including what's causing it. So we're going to be talking about that. We also want to have a good understanding of the system, that playing field, and how it's currently working. And that's what we're going to do in the second half of the workshop. So to do this, we're going to pull on our understanding of the socio-ecological model and employ some systems thinking strategies. You're all familiar with the socio-ecological model. Hopefully this looks familiar to you. As preventionists, we work across multiple contexts, which requires us to have an understanding of how systems are structured, how they interact, and what outcomes they're designed to produce. And to get a deep understanding of our challenge, we want to ask ourselves, what's happening at each of these levels of the socio-ecological model? What's happening that's causing or influencing the challenge that we're seeing? So as preventionists, we're going to focus a lot of our effort on population approaches. So what's happening at that community level, at the school or the neighborhood level, that's contributing to that challenge that we're seeing? What policies or belief systems are in place that create the environment where this challenge is going to continue? It might be things like policies that make it easy to access alcohol, or stigma that makes it feel shameful to ask for help, or people to feel hesitant to access mental health services. We can also think about what's going on in schools or communities that are an asset that we want to build on to address our challenge. This might be things like strong relationships or community resources. We might be thinking about best practice policies that exist that could help us address the challenge. So for this workshop, we're really going to be thinking about those outer layers of the socio-ecological model, the community layer and the societal layer. And we're going to keep these multiple contexts in mind as we build our skills as systems thinkers. And when we talk about systems thinking, I want to address a few key components of what it means to be a systems thinker. The first is a commitment to learning. It's about being curious. It's about thinking, what if, or recognizing that you don't know, and you're getting curious to find some answers. Another component is understanding and reflecting on diverse perspectives regarding the challenge. I see things one way because of the life experiences that I've had, because of the position that I hold, because of the educational background I've had. You might see the same challenge in a different way because of your perspective. So we want to seek out those different perspectives. We want to understand the pieces, being able to see the connections between the components of a system, understanding all those different parts and how they influence each other. And relatedly, that means being able to see the forest and the trees. We want to understand the pieces within the whole. And then finally, we want to be able to distinguish between technical and adaptive challenges and really look beyond the obvious issues to dig in to understand what root causes may be contributing to the challenges that we're seeing. So why are we talking about systems thinking and planning? Why is systems thinking important for planning? Feel free to come off of mute or drop your idea in the chat. Why is systems thinking, all those things we just talked about, why is that helpful when we're planning? Great thought, Asha. Being able to understand things from all sides. So seeing those different perspectives helps us come up with a better plan. We're able to address the cultural aspects of negative health outcomes. Not all challenges are created equal. It's not going to be a cookie cutter method. We need to have deep understanding in order to have plans that match the challenge. It's important to be inclusive. You need to understand the system so you can identify the variables where you can address. Love that point. Thanks so much, Rebecca. Being able to see the connections. If the system is fragmented, it can be hard to see all of the parts. It can be hard for folks to access different parts of the system. Raymond mentions that we're able to make a better roadmap. We're able to see what's ahead if we understand and have a good understanding of the system and the challenge that we're dealing with. Great. Thanks so much for all of the ideas coming into the chat. So when we have a full picture of how a system operates, we're able to come up with better solutions. Better understanding leads to better solutions. It also means that we can avoid some unintended consequences when we try a Band-Aid solution, when we don't have a full understanding of what the problem is. We might create additional challenges. So this is what we're going to practice right now, is getting that deep understanding of the challenge that you identified. And for many of you, you're recognizing my communities are facing many different challenges. So for this activity, I encourage you to think about one specific challenge and dig into that one specific challenge. We're going to take a few minutes to brainstorm a list of why your challenge is occurring. So open up that document again or find that piece of paper to jot down your ideas. What's causing your challenge? And I want you to go deep. Keep asking why. When you come up with one answer, ask why again. Because these are hard and complex challenges that you're trying to solve. If there were simple reasons, you would have solved them already. Think about that socio-ecological model as you're asking yourself why. What's happening at the school level? What's happening at the community or societal context that's making your challenge hard to solve? So come up with as many reasons as you can on your piece of paper. And we'll take about 4 or 5 minutes to do this on our own.
This is such a valuable exercise, Sarah, because so often, even when I was doing coalition work, I noticed that we'd always talk about the challenges that we were having, but we didn't necessarily break it down to find out why we were having the challenges that we were having, why they were occurring. Thank you.
A lot of you are recognizing things like lack of education or lack of awareness or lack of resources. Those are great things to identify, and you can take it a step further. Why aren't there enough resources? Why is the education not enough? What else is going on? Great examples. All right, well, let's hear from somebody who would like to share So thanks for continuing to drop ideas in the chat. We're looking for somebody to come off of mute and tell us what your example is and what some of the, especially the reasons, the root causes at the community or society level that you identified. Anybody willing to be brave? Great, thanks, Kimberly. Go for it.
I put that vaping use in one of our counties results in first offense for vaping from students in school are sent through the court system. And it's creating difficulties for the parents because they're the ones that have to pay the fines. The students aren't getting educated. We'd rather they be educated instead of sent through the court system. They're still missing school. And with all that being said, the school's not willing to change, and it is simplifying it for them because they don't have to deal with it. But then youth court is clogged up. They're saying that a student will come through, and before they even get to their first time to be back in court for their case, they have a second offense, and it starts all over. The parents have more fines. So that's our big issue and the problems with it.
Yeah, so hang with me just a second, Kimberly. This is a great challenge for us to dig into. So I saw that many of you are also looking at vaping. So this is a good example that Kimberly's bringing us with. So the challenge is vaping. We know that this is impacting youth and young people. Kimberly did a great job of listing several impacts of it's impacting the court system by clogging up the court system. It's impacting families because it's costing them money that they may not have. It's impacting young people because they're missing school. So we've got multiple different types of impacts that Kimberly's noticing. And Kimberly, when you thought about why is this a challenge? Why do we have vaping as a challenge with young people in our community? What were some of the reasons you came up with?
A lot of it in our community is a lot of the parents do it.
Okay.
So that's what the students are being brought up in.
Yeah, that's a great example.
So everybody needs education, not just the students, but the parents as well.
Great. So,
and
yep, go ahead.
Easy access to the vapes. There's, been some places in this county that sold to minors. So,
yeah,
just multiple things again.
Yeah, great example. Thanks, Kimberly. Thanks for letting me put you on the spot, for
You're
being
welcome.
brave and volunteering. Rosanna, I noticed that you in the chat are dealing with a similar challenge, and you mentioned the easy access as well. So we might have things happening at the interpersonal or family level, like families modeling the behavior, sending the message to their kids that it's okay. I see Meredith adding in the chat, parents providing vape products to their kids. We also have things happening at the community level, that there's easy access that retailers are selling to those who are underage. Rosanna also mentions in her comment up above in the chat that many teens believe vaping is safer than smoking. So we have belief systems that are at play as well. Latonia mentions peer pressure. Great. Kids thinking that it helps with anxiety. So there's both a belief system at play here about, I think this is going to help me with the anxiety. And also there is anxiety going on. So we have young people who are dealing with a mental health challenge, and this is one avenue that they're taking as a way to cope. Great. Angela's adding as well, parental buy-in, lack of trust in the effectiveness of resources. So we could provide education and information all day long. If we're not the trusted messenger of that information, maybe landing on deaf ears, it's not going to resonate as much. Media influence or influencers, the people I look up to, are vaping. Thanks for bringing that to light, Mally. Companies are advertising directly to children, so we have an industry that is making money off of this. These are great examples of when we ask why. Why are kids vaping? We're able to dig in and we're able to look at those reasons that happen across the socio-ecological model in all different levels. Oh, love seeing what's happening in the chat. This is great. So this is another exercise that you can do with your partners. You've identified what the challenge is. And Derek, I appreciate you sharing about it can be easy to get stuck in the talking about the challenge part, and we get clear about, yeah, we know this is a problem and this is a problem and this is a problem. And this is a way to take it to the next step of we're really clear about what the problem is. It's vaping among young people. Here's the impact that problem is having. Now let's dig in and understand why. Why is the problem occurring? Why do we have young people who are vaping? And you've just listed lots of different reasons. So this example, we used vaping as our example. That can be done with any of the examples that you all are looking at in terms of your challenges, digging in and asking why. So this is also information included on your handout as well. Remember, better understanding leads to better solutions. So when we take the time to ask why, to get a sense of why is this problem occurring, we're able to get a better understanding. So we can avoid the Band-Aid solutions of like, well, if they just knew how harmful it was, that would fix it. But if we look at our other root causes, we know that one solution isn't going to be the only solution. So this is helping us to plan. So not just addressing a symptom of the problem, but really what's at the core of the issue. All right, we're going to continue this theme of being curious, seeking to understand, trying to get a good understanding of what's going on in the system where our problem is occurring. So we defined a system as being a collection of interconnected parts. So that's a good definition to have in your mind. If you think about a community as a system, we have all these different parts of our community and they interact with each other. And we're going to think about the parts of our system as the 5 R's. So think about, as I go through these, think about what these components look like for the system in which your challenge exists. So the first R we'll talk about are roles. So these are the people in the system, the organizations. And if you think about your challenge, these are people who are impacted by the challenge, either personally or tangentially. So in Kimberly's example, it might be the young people. It might also be the families of the young people. Who's part of solving the challenge? What are the different organizations that are committed to trying to address this issue? Who's in some position of power that might control some resources related to the challenge? Maybe resources that could be put towards addressing the challenge. Or who's in charge of making policies that could help impact the challenge? So those are the people in our system, the roles in our system. Next, we've got the resources. So obviously we're going to think about money. We're also going to think about evidence-based programs, products, other assets. So these could be things like media campaigns, community coalitions, all of those are assets. Quit lines, crisis response hotlines, disease management programs. Those are resources. Our third R are rules. These are policies, laws that govern how things work. They can include regulations, criteria that include who's eligible for certain programs, what services could be billed to Medicaid, zoning laws, taxes. And we want to be thinking about how all of these policies are enforced, or maybe they're not enforced. I saw some of you mentioning in the chat when we were talking about underage purchases of substances. The fourth R we're going to think about are the relationships between those components. So we not only want to think about the parts of our system, but we want to understand the connection between those parts and how they influence each other. What's the interplay between them? Where are there strong relationships between elements of the system? Where are there no relationships at all? Where are there positive relationships? Where are there negative relationships? And all of these parts are working together to create that final R, the results of our system. So all of these parts of the system are working together to produce the results that we're currently seeing. So in this next exercise, we're going to use 4 of those R's to create a picture of the system in which our challenge exists so that we can start to get an idea. What does it look like? How is it working currently when we look at the roles, rules, and resources within a system and the relationships that connect them? So grab your paper or your work on your document on your computer. We're going to be making some lists. And the first list we're going to make is the roles. So again, think about one specific challenge that your community is facing and start to make a list of organizations or institutions or people who's impacted by the issue, who's trying to address the issue. You might even think about anybody working against addressing the issue's impact. Does anybody benefit from keeping the issue in place? Someone mentioned tobacco companies who are making money off of flavored tobacco and vape products. That might be an example of a role, someone in your system who is benefiting by keeping the problem in place. So think about all the players in your system and make a list. So we'll take 2 minutes here on our own to start that list.
Inspires me when I see this, Sarah. So like you have those aha moments where you're like, oh, the enemies of my enemy are my friends. Like I have to go find those people who are being impacted and how I can work with them as well. So
If you're done making your list, you've run out of ideas, feel free to drop some of those roles. Who are the people or the organizations who are ending up on your list? That might give others some ideas as well. Feel free to drop those in the chat.
Sarah, how do we deal with those enemies who are actually our friends at the same time? When I was doing coalition work, we had the Budweiser company who were clearly trying to market to minors with their flavored drinks, but then they would give us free water to give out at our events.
That's such a great example, Derek. And as we move this activity forward, you'll see why it can be so valuable to think about who are the players. And then in just a minute, we're going to be thinking about what those relationships are like. And there may be some that you have a great relationship because they're helping you get some money, but yet they're also part of the problem and impacting a group of people that you're interested in helping. So this will really help bring some of that to light. Some great examples coming into the chat: a homelessness board, drug education council, drug-free communities, individuals experiencing homelessness, single-family households, town board, mayor. So thinking about who has some power in these situations, who's making policies, young people, parents, prevention professionals, teachers, retailers who sell tobacco or vape products, mental health providers, local dispensaries, families, other nonprofit groups in our community, liquor stores, drug dealers, coalitions, peers, the state correction system, schools, city council members, other substance use or addiction organizations, bars and restaurants. So our lists are going to be a little different depending on what our challenge is, but hopefully this is sparking some ideas of all of the different roles that we want to be thinking about. Who are all the players in our system? Now we're moving on to our second list. For this one, we're going to be thinking about rules, and you're thinking about laws, policies, practices. So which of these laws or policies impact the issue positively? Which of them impact negatively? Again, we can think about rules pretty broadly. It could be things at the school or the workplace level, policies that are in place. It could be a national law. It could be a county ordinance. Rules can also be practices, the way things are done, even if they aren't official policies that are written down somewhere. They might be things related to zoning or density, things that impact availability, things that impact who's eligible for which resources. So go ahead and brainstorm your list of rules. We'll take a couple minutes. And when you're ready, feel free to drop some ideas into the chat. What's showing up on your rules list? What rules are impacting your challenge? Looks like, Jillian, you're addressing some issues around access to housing. So thinking about policies of who qualifies for certain policies that may pay portions of someone's rent, policies that help with covering heating costs, benefits like SNAP that help to cover food costs. So thinking about policies that are impacting individuals' access to services. Liza's mentioning a liquor tax. So something that impacts the price of a product. Something like a tobacco 21, raising the age of who can purchase tobacco to 21. Is that policy in place or not? Is that policy being enforced or not? Great question to raise, Esme. Are people following the policies? Are they being enforced? Sarah mentions things like income qualifications for mental health services. So this is helping us to get a picture of what's going on in our system. What kind of things exist? What kind of rules exist that are going to impact whether or not someone accesses mental health services? Melissa mentioned some policies at the school level. Elias about putting cancer warning labels on alcohol. Great. Love seeing the diversity of ideas here. Some of these are county-based ordinances. Some of these are policies at a school district level. Some of these are federal policies that are in place that may or may not be getting enforced in your area. Right to carry laws. Virginia Lee, thanks for bringing up this idea. So we might be thinking about things in a substance use realm, and we want to be thinking about what policies impact and are adjacent to that. Great example. Zero tolerance policies in schools. All right, we're moving on to our third list. Actually, we're not moving on to our third list yet. We're bouncing back to our first list because maybe while you were making that list of rules, maybe that sparked some additional ideas of roles that you want to add. Now that you see the rules that you've listed, is there anybody else you want to add to your first list, your roles list? Who has the power to make changes to any of those policies or rules that you listed? If they're not on your roles list, go ahead and add them. Who has the power to make those policies? Who decides how those policies are implemented or enforced? Add those folks to your roles list if they weren't already on them. We might be thinking about the people who have the power to pass a policy or remove a policy. You might be thinking about who has the power to bring about change in a policy, such as advocacy groups. You might be thinking about who has the power to enforce or decide how a policy is enforced. That might be a judge. That might be law enforcement. That might be a health department. All right, now we're going to move on to our third list. So this is our last list that we're going to be writing, and we're thinking about resources. So everybody just go ahead and write down money, because that's the easy one. We all need it. We all need more of it than we have. So that's one resource. So what financial resources are available to help reduce the issue? You might also think about the flip side of money. Is there money that's working against resolving the challenge? Again, when we think about businesses or corporations who are benefiting from the challenge staying in place, those are resources working against resolving the challenge. And now push yourself to think about those other resources, the other assets that are related to your challenge. Prevention programs, suicide hotlines, support groups, community coalitions, advocacy groups, media campaigns. You might think about protective factors. What assets this community has? Are they strong cultural foundations? Are there strong family connections and social networks? So make a list of resources. We'll take 2 more minutes for this. When you're ready, put some of your resource examples in the chat. Training for staff is a great example that Rebecca mentioned. So not only having staff, prevention professionals, but also having them well trained. Great example. Programs, grants for prevention, money given to communities from lawsuits related to opioids. Great example, Meredith. Community support. Thanks, Hannah. Youth coalitions. Mental health providers. So you're seeing there's some overlap between our roles list, probably, and our resources. So many of those individuals or organizations that you might have listed are truly serve as a resource to the community. Data sharing, great one to lift up, Diana. So when we are able to share data, when we have data sharing agreements in our community, that increases what we're able to do. That increases our depth of understanding of the challenge. Having evaluators, having passionate people, peer support workers, community healthcare workers, having individuals with lived experience that can help inform the work. Great asset to mention, engaged parents. 988 and 211, I'm assuming these are like crisis support lines or resource helplines. Narcan. Okay, I'm ready. Different media campaigns. Websites that help connect people to resources. Great examples that are coming in. So now let's bring in our fourth R, which is relationships. This is when you really need some paper and pen. So grab some paper and pen that Derek mentioned at the beginning, because you're going to be drawing. You're going to tap in to that younger self of yours, for those of you who don't draw on a regular basis. You're not going to have time to do a full picture, but I want you to pick a couple items from each of your lists. Who's currently connected to each other? So pick a couple roles from your role list, add in some of those resources, and I want you to think about drawing those connections. I want you to draw the connections between those different components. So how are these few roles that you're picking out connected to the resources? How do the resources flow? You might use arrows to show where the money is going. You can think about using different kinds of lines to represent different types of relationships. Maybe you've got heavy, bold lines between groups that are well connected, and maybe there are some dotted lines between groups that aren't as connected, or a policy that's not well enforced or not consistently enforced. So look back at your three lists, pick a couple items from each of your lists, and I encourage you to use pictures as you're drawing these. So pictures and lines rather than words in your drawing. You do not need to be a great artist to do this activity. The only way you can do it wrong is to not try. So we'll take a few minutes to draw on our own, and when we come back, I'm going to look for 2 volunteers who want to actually share their picture with the group. But for right now, draw on your own.
I just love this exercise, Sarah. It's really useful because it really connects the real world with your brain. I've always used exercises like this when I'm working with coalitions to help them get a better picture. And so often people are like, I just got to get this out of my head. I got to get it out of my head. And this is the way you do it.
Yeah, those lists are great. And a picture takes it to the next level. We're able to show the relationships and the nuances of those relationships. Amy mentions in the chat, retail stores, they could be part of the problem when it comes to underage selling. They could also be part of the solution and allies. So we might have on our picture some retail stores that we have a negative relationship with or a strained relationship because they're contributing to the problem, while we have a really positive relationship with other retail stores that are serving as allies. So a picture helps us think about the nuances of how our components are connected and working together or working against each other in our system. All right, I'm going to pull us back together. You can keep sketching on the side if your interest is piqued here. So as we reflect on this activity, this is called a rich picture. is the name of this activity. I'm curious to learn more. How'd you find that activity? We're going to launch a quick poll here. Was it frustrating, overwhelming? Maybe you found it interesting or helpful. No wrong answer when we're talking about feelings. Another few seconds to answer the poll. All right, so a few of you found this frustrating or overwhelming. Do you mind coming off of mute or dropping it into the chat? If you're somebody who found this activity a little frustrating or overwhelming, what was it about it that felt frustrating or overwhelming?
I can say. I said frustrating.
Yeah.
And not in like the activity itself was frustrating, but more of like when I was making connections between like agencies, specifically the way I did it was more of like who provides services, who has access to funds. I kind of did it in that way. I was seeing a lot more connections that I feel like could be producing results that currently like aren't. So it was more of like I'm seeing a picture that I think has already existed for a while and no one's like taking access to it. More frustrating, not the actual activity.
Yeah. Love that. Thanks so much, Sarah. Maybe you saw things in your picture that seemed frustrating. Anybody else want to share what felt overwhelming or frustrating? Because you're not alone. All right, how about somebody who found it interesting or helpful? Who would be willing to come off of mute and share?
Hi, good morning. Good afternoon already.
Yeah.
So I think I found it interesting because this help us to try to like put for everything on paper and see the big picture. Many times it's difficult try to put together everything and try to like identify the components, but I think through this method it has been really helpful because we could see in detail what are like for instance, agents that can support the cause and the other ones that are against maybe to this. We did our diagram here.
Yeah, bring it a little bit closer.
Yeah. Oh my gosh, I can.
I know, Zoom's not helping us out here.
No, sure, but I'm going to explain it quickly. For instance, we are putting our project is like try to support undocumented youth in order to promote inclusion here in the place in the area we are working. So the roles we identified, for instance, in general, the federal government, the local government agencies, other nonprofits as well as community-based organizations, schools, police department. Then the rules that we identified are the federal government cut-off policies, one Fairfax policy, which is the area in which we are working, the trust policy implemented here as well, early childhood local plan, the community health plan as well.
Yeah.
In the relationship, it's like we set here the immigrant and undocumented communities in general and how we are trying to like build rapport with the community in order to make them feel included. So within this, we can find the youth that we want to affect or to try to help. So in favor, we have, for instance, the schools, local agencies, community-based organizations, faith organizations, and the police department who are trying to build rapport with the community, being present to try to support, to try to like make them feel included as well. Youth also can like have this contact with role models and feel motivated to continue growing professionally, academically, socially. But on the other hand, the factors that are against this is basically some agencies in the federal government. And
Uh-huh.
that's the frustrating part, let's say. For instance, agencies like have been trying to like change the school system, have been like cutting off resources for the community which we serve, and
Yeah.
also the law enforcement in that level that it's
Yeah.
like allocating funds to try to be more present, and even they are trying to be present in strategic locations in which most of these community that try to like find support get resources, food
Yes.
distributions, supply distributions, and other kind of distributions in which we have a lot of
Yeah.
community uh, bringing together. So this is basically our scheme. I'm not sure if you can check it, by the way.
We all want to be able to see it. This is fantastic. Thank you so much, Santiago, and you had a teammate there, which was probably a nice opportunity to be able to do this exercise with someone else. And maybe a few of you were kind of wishing that you had somebody else there in your office to do this with you. So thank you so much for sharing that part. And want to mention a couple of things that you said. You were able to see the big picture. When we think back to those components of systems thinking, part of it is being able to see the parts as well as the big picture. So not only the parts, but how the parts are in relationship with each other. Santiago also mentioned how the pictures can really help us understand the nuance of what's going on. So maybe local law enforcement is a big asset and is really helping, and there's a nice, strong, positive relationship there. And local law enforcement is impacted by federal policies or by state influencers saying how they need to do their work. So we're able to see how different parts of our system are impacted as well. So lots of different layers there. Thanks so much for sharing that. Rebecca also mentions in the chat, it was interesting to consider the relationships. Some are more indirect, and it was helpful to see that on paper. So making a list is one thing. Here are all of the partners. Here are all the different agencies in the community. When we draw it on paper, we're able to actually see, are we connected to all of those different agencies? Or maybe this is a little bit more indirect or not as strong as we wanted it to. Great. All right. Thanks so much for taking the poll. Again, all the different feelings about this activity are completely legitimate. So thanks so much for sharing. Encourage others of you to continue to drop ideas in the chat or realizations. If you found it helpful, what was it that was helpful about this particular rich picture activity? What initial observations did you have about your system when you looked at the components and how things were connected? So a few of you have dropped it into the chat, but I'm curious to hear for some others. What did you observe? What did you notice looking at your picture? What stands out to you?
Meredith Starr has her hand raised.
Oh, thank you. Go for it, Meredith.
I was just going to say, when I started drawing mine, um, maybe I'm like a tad self-centered, but I drew my organization in the center first because, I'm trying to figure out how connected we are to everything else in our community. And then I kind of just like spread out from there. So I don't know if you guys can really see it. It's also hard because I use the line paper, but yeah, no, I was trying to also think about like who like we more directly work with and place them, I guess, more closer to our office building in the picture. And then organizations and partners that we may not always work as closely with, or maybe we don't really have a relationship with them. they're a little bit more out there, but it also made me think that like maybe we should partner with them. We should make that connection. And so I drew like little walkway paths to connect the organizations together. And yeah, I also drew our little Mount Greylock in the back if anyone's interested in coming to Massachusetts. It's the highest point in Massachusetts.
There you go. It's like a public service announcement for the travel board too.
Yes, come
Yeah.
visit.
Yeah. Thanks, Meredith, for sharing. And it's fun to hear how different ones of us approach drawing the picture. And so Meredith shared that like the organizations that are most closely connected, she drew close together. And then those that were further apart, drew physically further apart on the map. Some of you may have done that through lines, different types of lines connecting. Show of hands, how many of you put your organization at the center of your picture? Meredith's not the only one. I know. Yeah, lots of folks. So that's a pretty natural place to start, right? We know what we know. So we start with our organization and we think about how we're connected. And when we're sitting with somebody else at the table, sitting with other organizations at the table, we can't all be in the center of the picture. So it helps us think about the picture differently when we bring in additional voices. So yet another activity that you can do with your coalition or coalition partners. So this activity is included on the handout as well. So why did we draw a picture? What do rich pictures have to do with strategic planning? And I think you're getting at this. We've already talked about it in the chat a little bit. But we know that there's lots of research that backs this up about making pictures, drawing through any kind of medium, stimulates different parts of our brain. It causes us to think differently. So it works as a cognitive tool. It helps us make the invisible visible. It helps us tap into creativity, which requires our brain to think differently, which unlocks some really powerful critical thinking tools and problem solving tools. So it can be a nice new tool in your toolbox to think about, what would this look like if I drew it? What would it look like visually? Visuals also help us to see leverage points. And leverage points are places within a complex system where a shift in one area can produce changes in other parts of the system. Rich pictures help us find those places in a few different ways. They help us to make those connections visible. So when we map out how different parts of a system interact, we can see which parts are closely connected and which ones may be more distantly connected, and where a change in one area might create ripples and influence other areas. They also help us bring in diverse perspectives. So most of you were likely doing this activity by yourself. What would it be like doing it with other partners with other people in your organization? What would it look like with other partners in the community, doing it with your coalition? So if you were able to look at each other's pictures, you might have had oh, I didn't think about representing it that way, or oh, I didn't think to bring in this partner, or I didn't know the influence that this law had on this particular organization or group of people. So when we include insights from state, local, community partners, we're able to get a fuller picture of how our system works, because no group sees everything. So it's important to have as many partners around the table as possible so that we can spot these leverage points where change can happen. Rich pictures also help us reveal patterns like feedback loops. They show how different parts are either reinforcing or balancing each other out. And again, where could we make a shift in order to get a different result? And then when we create these rich pictures together, we're building shared understanding and buy-in. So that shared view helps us all move in the same direction, helps us get bought into that future goal that we're all trying to get to, so that we're willing to invest the time and resources where they matter the most. And all of this is needed for good planning. We're getting that deeper, richer understanding of the problem by asking why. And we're getting an understanding of the system by drawing a picture and seeing the components of it. Helps us understand leverage points and where those opportunities for changing the system are. And it gives us this amazing opportunity to engage with our community partners, because the problems that we're all addressing, these challenges that you were thinking of at the beginning, these are bigger than any one of our organizations can address on our own. And we know that, and this is a way to engage with other partners. So, as we wrap up, a reminder of our model of change. There's something about our current state that we want to change. There's a challenge that we want to change. We know the future state of where we're trying to go. And we can use tools like 5Rs and rich pictures to understand and picture things holistically, to understand the playing field, so that we can identify where those opportunities or leverage points are to change the system, so that we can get to that future state vision, the results, where our problem has been solved. So what you can do with all of this, we gave a little taste of a few different tools and ways of thinking today that can help support your approach to planning. You can do longer versions of these activities with your coalition or with partners, creating a theory of change by creating a challenge statement and a vision, doing the 5Rs so that you understand. Maybe during a coalition meeting, you're asking partners to brainstorm. Who are the roles, the rules, the resources? You might be surprised to see what else ends up on the list when you involve other people with different perspectives. And you're identifying that result that you're trying to get to so that you have a collective vision. You could do this, have folks do this individually and then bring folks together. You could do a collective big flip chart where everybody's working together. As individuals on a daily basis, we can practice systems thinking. So when an issue comes up, when we're presented with a challenge, we're going to get curious and ask why. We're going to try and really understand that challenge. We're going to think about what might be causing the issue, and we're going to be thinking about those causes at the community level, at the societal level. What's influencing the challenge? And we're going to seek out those additional perspectives. What do others think? What brought them to their way of thinking? And we're going to look for how those things are connected. We're going to look for the relationships and the connections. So as we close today, I want to provide some time for questions. Feel free to drop them into the chat or come off of mute. Thanks for the comments in the chat. Any questions this sparked for folks?
It's like lots of love and lots of thank yous.
We'll take it.
This was awesome. This is another thank you. Thanks for making it. This was great. No questions. Thank you.
Well, Richard has
job.
dropped the handout in the chat. I think you'll get a copy of the slides as well. So hopefully this is just a starting point for some further conversations you can have with partners.
But if y'all do have any additional questions that you even think of later, feel free to contact me and let me know about those questions, and we'll do our best to answer them for you. Well, as we close today, I just want you to remember that effective prevention isn't about doing more. It's about doing something that matters the most. So when strategy, action, and systems are aligned, prevention moves from intention to actual impact. And that's what our focus was today. I encourage you to take what Sarah has discussed with you today and apply it intentionally within your communities and identify those leverage points so you can strengthen partnerships and stay focused on sustainable change. We need your feedback. So if you can use your phone to get the QR code right there, or there's going to be a link placed into the chat. Your feedback helps us to improve our programs in the future. If you're unable to either use the link in the chat or the QR code on the screen, you will, when you leave, you'll have a pop-up that comes up and gives you an opportunity to complete the survey at that time. I want to thank my team at this time for helping put this program forward. Of course, we always appreciate Sarah Davis for sharing her time with us and her insight. Richard Feinberg has provided all the technical assistance that you need today. He's the reason why things ran so smoothly. Deborah Livingston, she is our curriculum specialist. She's helped in ensuring that the point that we want to make in providing this information to you is clearly made, and that it's also accessible as well to everyone who takes part in this. These slides will be available to you, as well as a recording of this program on our website in about a week or two. And then you'll also receive a certificate of attendance as well via email. So thank you to our fellow Trevor McCain, who's been with us for a while now. He is learning and working at the same time. It takes young people just like him to keep prevention going. He is the future of prevention. So last but definitely not least, I want to let you know about exclusive office hours that we have for you. For those who are joining us from Region 6, we're offering an exclusive opportunity to continue to work beyond today's Prevention Playbook workshop. We'll provide complimentary one-on-one office hour sessions designed specifically for people who participated today. So during these sessions, we'll review your current strategic plan. We'll walk you through the 5 R's and how it applies to your work. We'll help you strengthen your alignment with the risk and protective factors, and also refine your messaging and data integration as well. But most importantly, we'll discuss how to apply today's tools in real-world implementation. So this opportunity is available exclusively to Prevention Playbook attendees. You had to be here today, and you have to be from Region 6, which is Arkansas, Louisiana, Texas, New Mexico, and Oklahoma. But if you are living in other states and you're interested, then I encourage you to contact Sarah Davis directly as well. Rather than being our consultant, she also works for herself. So you can also contact her. We'll put you in contact with her if you have some exclusive work that she can do for you related to the message today. So if you're interested, simply reach out to me, Derek Newby, and you see on this slide my contact information, dlnewby at ou.edu. We also encourage you to sign up at our website. You can sign up for our mailing list, and also any products and resources that we have are free for you because we're with the PTTC, which is the Prevention Technology Transfer Center. So without further ado, I give you back the rest of your day exactly on time at 11:30. Thank you for attending today.
Thanks, everybody. Take care.